Hello, good evening. My name is Gabriel Gonzalez, and today I would like to discuss with you on ways and how to quit smoking. Some ugly facts about smoking are that 52 million Americans smoke cigarettes on a daily basis. 400,000 people in this country die every year due to smoking-related illnesses. Each cigarette you smoke shortens your life by 14 minutes. Smokers have a limited sense of smell, greater risk of chest infections, greater risk of developing cancer, greater risk of blindness, greater risk of periodontal or gum disease, more wrinkles in your skin, and pale gray skin. Smoking today, there is a lot of confusion and conflicts about the role smoking plays in lives of smokers. On one hand, smokers feel their habit is pleasant and relaxing. On the other hand, smokers know it is a serious health hazard. 39 states have laws prohibiting and limiting smoking in public places. Smokers often feel like the outcast today. Why do you smoke? Nicotine is the only psychoactive ingredient in tobacco smoke. Addictive smokers smoke for one principal reason: to get their accustomed doses of nicotine. When you stop smoking, you will likely experience unpleasant side effects. Research shows that nicotine provides a variety of desirable psychological effects. Rewards of smoking. The average smoker takes 10 puffs per cigarette. If you smoke a pack of cigarettes a day, this is about 200 puffs total. Each puff of nicotine reaches the smoker's brain within 7 seconds, twice as fast as a syringe full of heroin injected into a vein. Once nicotine enters the brain, it begins to mimic the brain's most powerful chemical messengers. The result: enhanced pleasure, decreased anxiety, and a state of alert relaxation. Because of this positive reinforcement, many times a day, each time a cigarette is smoked, smoking becomes a part of every aspect of a smoker's life. Most smokers say that smoking helps with concentration, helps reduce tension, helps them relax, decreases feelings of distress, helps keep their weight down, and increases energy levels. With all these rewards, no wonder it's so hard to quit smoking. The rewards of smoking go a long way towards minimizing the negative consequences, and even longer way toward ensuring that the act of smoking is repeated again and again until it becomes a habit so well ingrained that you do it without even thinking about it. But smoking it's not just a habit, it's an addiction. Nicotine in cigarettes is a powerful addictive drug that makes smokers feel good. Each time you smoke, the positive biological effects of nicotine add to all the other positive rewards of smoking, making that habit even stronger. Some of the effects of nicotine affects almost every organ system in the body. When you puff, your heart beats faster, veins constrict, making the blood vessel and the flow a lot smaller and difficult. Blood pressure increases, adrenal gland pumps out adrenaline, smooth muscle relax, metabolic rate increases, even the electric activity in the brain changes. Nicotine is a powerful drug. It is one of the most toxic of all drugs, comparable with cyanide. Take enough of it and it can kill you. Each cigarette generally contains 8 or 9 milligrams of nicotine. However, the amount of nicotine inhaled from each cigarette is only 1.5 milligrams. The amount of nicotine inhaled can be higher or lower depending on the type of cigarette that you're smoking, how deeply you inhale, and how many puffs you take from each cigarette. However, nicotine is so potent that even a small dose can cause significant changes in functioning of the numerous organ systems in the body. When you first start smoking, these changes are generally unpleasant. Beginner smokers usually experience nausea, dizziness, headache, coughing, along with other unpleasant symptoms. However, people who continue to smoke soon develop a tolerance to these symptoms until they become unnoticeable. Tolerance is a term used to describe an important feature of addiction. Tolerance develops when increasingly larger doses of a drug have to be administered to obtain the effects observed with the original dose. Smoking is both a habit and an addiction. Habits are affected by your environment. Something you see or do in your daily life triggers them. Triggers are the stimuli associated with smoking. What are your smoking triggers? 3 reasons for smoking. Nicotine is a powerful reinforcement. The act of smoking offers many positive reinforcements. The reinforcements becomes associated with many activities in our daily life. Smoking is tied to many satisfactions each day. No wonder it is hard to stop. Research indicates that one of the most helpful things you can do to break the smoking habit is to stop and notice your smoking triggers. The things you do in your life and your daily life that trigger you to smoke. What smoking does to your body. Smoking is a major health hazard. Smoking increases your risk of death and illness from many diseases. The U.S. Surgeon General has called cigarette smoking the chief preventable cause of death in our society. What smoking does to your body also includes lung cancer, which the risk increases 50 to 100% for each cigarette you smoke per day. Heart disease risk increases 100% for each pack of cigarettes you smoke per day. Switching to filter tip cigarettes decreases your risk of lung cancer about 20%, but not the risk of heart disease. Smokers spend 27% more time in the hospital and more than twice as much time in the intensive care units than non-smokers. Each cigarette costs a smoker 14 minutes of life. Smokers are at twice the risk of dying before the age of 65 than non-smokers. Good news. The great majority of negative health effects can be reduced or eliminated by quitting. What you need to do to quit. Make a plan. Adopt a healthier lifestyle, which includes eating right, exercising, managing stress, and getting support from family and friends. Develop your quitting plan. What type of program is best for you? A self-help plan or a group support program? What method of quitting is best for you? Cold turkey or slowly weaning off nicotine and cigarettes? Do you want to use medication to boost your efforts? Experts have found that the most popular method of quitting is cold turkey. However, just throwing your cigarettes away on a whim rarely works for more than a day or two. Planning a quit date and then quitting, all or nothing, usually works. The benefits of quitting is that within 12 hours, the carbon monoxide level in your blood returns to normal. 2 to 12 weeks, blood circulation and lung function begin to improve. Within 1 year, the increased risk of having a heart attack is reduced by half. Within 5 years, the risk of a stroke is reduced to the same risk as a person who never smoked in the past. Within 10 years, the risk of lung cancer is reduced. And within 15 years, the risk of heart disease is that of a non-smoker. Other benefits that include as well are that food tastes better, you have more energy, your breath and clothes and hair won't smell like smoke, you are saving money in the long run, you are now more in control of your life and actions now that you are no longer addicted to cigarettes. So give it up and stop smoking for life.